Hi, Dr. Yass here. I'd like to discuss the issue of balance, especially as it pertains to older people, and the sense that the issue of balance is something that is part of the aging process, and that somehow, because you get older, that means that you can anticipate that your balance will be affected, and therefore the need for assistive devices, or even getting to the point where you may be required to move into an assisted living home, is just completely a 100% fallacy. There is absolutely no reason to think that simply because you're getting older that your balance has to be compromised. It is horrible that as you get older, if for some reason you trip, the medical practitioner you go to will suggest or recommend that you use a cane. The problem with the mere promotion of a cane and simply stopping at that is that by using a cane, you are beginning to develop support of your body weight through the arm by use of the cane. As a result of this, you're taking away some of the force requirement that your legs have to respond to. So as a result, you will, by using a cane for a sustained period of time, cause your legs to weaken. As a result of this, this will make you more susceptible to having balance issues. The muscles most responsible for providing balance are the gluteus medius muscles. These are the muscles that attach to the pelvis on the side just above the hip joint. They are responsible when you're single leg standing to keep the pelvis level. When the pelvis is level, you have balance. If the gluteus medius muscle is weak, it will cause the opposing side of the pelvis to fall, which causes your center of mass to the opposite side of the body that you're standing on. This is what typically leads to a sense of instability. So the idea that you tripped possibly due to some sense of instability, and that the answer is to simply provide a cane, is basically a remedy towards moving towards greater instability. So then you'll fall again, and the answer is, well, let's move you to a walker. This is now a two-armed support, causing greater support of the body weight to be absorbed by the arms, causing the legs to become even weaker, making you more susceptible to falling due to instability. So eventually you're left moving to a wheelchair, at which time there is no weight bearing. You now are at the point where your legs aren't supporting you at all. They now become extremely weak, and that's it. You're stuck in a wheelchair. What we need to discuss and understand is that when we talk about the phrase balance as an overriding statement, there are two components to the idea of balance. There is the neurological component, which is the sense of where you are in space, and this is developed by the semicircular canals in the air and the cerebellum. And this is basically acting as a way of telling you where you are in space. So if you start falling to the side, this creates recognition that your center of mass is moving outside of your base of support and tries to signal to you that you're falling. Now, if this is completely intact, which for most people it is, and I'll explain how we would know that for sure, but if it is intact, what's about to happen is then that sense that you're about to fall sends signals to muscles in the legs to contract to help support you, to push you back the other way. But what if those muscles were weak? What if they didn't have the force capacity to be able to push you back, to stop your center of mass from moving side to side or front to back? You will fall. And the premise will be that you were, quote unquote, unstable or had a balance deficit, when in fact, it was simply weakness. The neurological component of balance is completely intact. It's just that the muscles don't have enough strength to respond to the signaling it is being given to create the force requirements to push you back over your base of support. So My preposition to people is that for most of you, if you're saying that you are fully stable when you're seated, but your sense of instability occurs strictly when you're standing, walking, or doing some sort of weight-bearing activity, you must recognize that the quote-unquote instability you're describing is not instability, but in fact is muscle weakness. The neurological component of balance is perfectly intact. It is the weakness of muscles which are incapable of responding to the request to contract and push you back into your base of support to make you stable from the healthy and fully functioning neurological component of balance. That's why you fall. So if you're questioning, if someone's telling you, oh, you have a balance issue, think of it as quite simply two elements: a neurological element, which is the awareness of where you are in space, and then the muscular component, which is the ability of the muscles to respond if you do go outside your base of support to push you back. You would know that it is the neurological component quite simply if you are incapable of sitting without support. If you're sitting on a chair, you're not leaning back against a backrest, but you're simply trying to sit, and you can, that immediately indicates the neurological component of balance is intact, 100%. If you had a deficit of the neurological component, such as when people have inner ear infections, these people will tell you that if you even begin to try to get up from a laying down position, you will feel dizzy, you will feel possibly nauseous, you will find it difficult or almost impossible to find your center, your ability to sit without feeling like you're going to fall. That's because of the deficit of the semicircular canals in the ears to work properly to identify where your center of mass is and your ability to be upright and stable. So, quite simply, if you're having a balance deficit with standing or any other form of weight bearing, and you can sit without support of the back and you are quite stable, you could immediately assert that you do not have a neurological deficit to your balance. It is strictly muscular in the legs, and you simply need to identify which muscles are preventing you from having this sense of being able to push back into your base of support so that you could remain stable after the healthy neurological component of your balance has activated. In most cases, if we're talking about a side-to-side instability, we're talking about your gluteus medius muscles, these muscles that are responsible for developing a level posture of the pelvis, which when level means that you're stable. If you're having a front-to-back instability, it typically means that there's an imbalance between the quads and the hip flexors, the front thigh and front pelvic muscles, compared to the gluteus maximus and hamstring muscles, the posterior pelvic and posterior thigh muscles. And as a result, these muscles, the hip flexors and quads, have a tendency to shorten, which causes you to be hip flex forward, which causes your center of mass to be in front of your ankle, so that if you stand for long enough or begin to walk, your center of mass moves too far forward and you begin to have momentum in which you fall forward. For those who fall back, it's typically that they're trying to compensate for that, and they actually try to reach too far back, lean too far back, and that causes their center of mass to get behind their heel, and that's why they fall backwards. But in all of these cases, falling side to side, falling forward or back, in almost all these cases that I've experienced where someone was described as having some sort of vertigo or dizziness or balance deficit, the issue was always a muscular deficit, because when I simply had the person sit without their back being supported, they were fully stable. They had no problem. And if I even said go from laying down to sit, they really had no problem. So let's start to understand that this issue of balance, especially relating to older people, I am so in tune because I've treated so many people in the 80s, 90s, and even few people in the hundreds, that their greatest fear is loss of independence, and the thing that seems to be most associated with loss of independence is the fear of falling and the sense that balance is being altered. And I want you folks to recognize that if you can sit without your back supported and you are fully stable, trust me, the balance difficulty you're experiencing with standing or any other weight bearing is just a muscular problem, we could do some targeted strength training and we can get your balance fully back. If you start to use a cane, which if you are unstable, I'm all for, but along with getting the cane, you need to begin a strength training program so that you don't go from the cane to the walker, you go from the cane back to no assistive device. And this can be done, and I've done it for several hundreds, if not thousands of people over my 2 decades of treating patients. I'm telling you, this is the path. It can be done. So if you want more information about balance and the strong correlation to strength in sustaining balance, you can go to my website at www.mitchellyass.com. That's MITCHELLYASS.com. Or you can email me at drmitch@mitchellyass.com. That's drmitch@MITCHELLYASS.com. Or just call me on my cell, 516-449-1359. I know people are surprised when they hear that I give my cell phone number, but I feel that I am a vehicle to assist people in resolving their deficits, whether it's pain or instability or any other deficit, and allowing them to have the quality of life that they so deserve. There are basically no mechanisms or practitioners in a position to understand these types of situations, so people suffer. As I said, the multitude of people that I've worked with have gone from cane to walker to wheelchair. I think that is appalling that their quality of life is suffering and has been taken away by a medical establishment incapable of correlating the idea of increasing strength to actually increasing balance. So please find the Yass method. Take one of these methods to get in touch with me or get the information you need. Let's get your quality of life to where it needs to be. Let's keep you independent. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye.